General, you filed the suit against Purdue Pharma, Johnson & Johnson, Allergan, and Teva Pharmaceutical. Why?
Well, I took this job on February 20th of this year, and one of the first things that I became aware of in a very unfortunate way was the extent to which our state has been beset by an incredible oversupply of opioids by pharmaceuticals. We began to look at this matter in a very thoughtful and deliberate way, and what we've concluded is that this, what I'm calling oversupply of these drugs, is deliberate and honestly pretty cold-blooded. So we're going to hold these companies accountable. We have a couple of decades here where, again, these companies, as far as we're concerned, have misrepresented, fraudulently marketed these drugs into our state, misrepresented to doctors their addictive qualities. And the consequence is we've had almost 3,000 opioid overdose deaths in our state over the last 3 years, and it's going to stop.
And it's not a problem, Mr. Attorney General, that's just unique to Oklahoma. But I want to ask you in particular, you said that the drug companies have been misrepresenting to doctors who prescribe these pills to patients. 33,000 deaths in 2015, the last federal government numbers that we have available to us, the new numbers being crunched now. But what role do doctors have to play? Do you think that they serve any legal liability at all?
Well, by and large, the medical community is doing its job with respect to how it treats patients. Unfortunately, there's a sector of the medical community who is not. But our focus is to hold the pharmaceuticals accountable. Again, we think they've misrepresented to doctors the addictive qualities of these drugs, and they've done so in a conscious, cold-blooded way. The goal here is profits, it's not patients. So we're focused again on the pharmaceuticals, but when we find doctors who are in a deliberate and honestly criminal fashion giving these drugs to patients in a way that's not consistent with law or their doctor-patient responsibilities, we're prosecuting them, and we did just that a little over a week ago. We charged a doctor here in Central Oklahoma with 4 counts of second-degree murder.
Yeah. How much restitution are you seeking from these companies?
We're still building our damage model, Kevin. It could reach into the hundreds of millions of dollars. Again, the costs that are healthcare complex in the state, law enforcement, rehabilitation for folks who become addicted, it's a massive outflow of taxpayer dollars that we're focused on recouping.
I want to pivot here to Washington because, again, as I said, this is not unique just to Oklahoma. It doesn't really matter if you're in the Upper East Side in New York City or Upper Darby in Delaware County, Pennsylvania, the county where I grew up in. The New York Times last month, Attorney General suggesting that reporting that the leading cause of death under people the age of 50 is now drug overdoses. Washington is debating a health care bill. Senator Rob Portman calling for $40 billion, as well as a bipartisan group of lawmakers. The majority leader's plan only has $2 billion. What can Washington do with this health care plan to help your cause?
Well, the opioid epidemic has got to be approached on multiple fronts. I think the pharmaceuticals have to be held accountable. Their marketing techniques have to be stopped, and that's part of the goal of our lawsuit. There's a rehabilitation element to all this, and the federal government can definitely help there. Because honestly, addiction's an illness, and dealing with demand is going to be an important part of this. If we can get people the help that they need, that's going to affect supply. Obviously, that's fundamental. There's also a law enforcement piece to all this. We've got to have more boots on the ground. We've got to have better cooperation between the states and the federal government, and I hope Washington can help there. Lastly, we've got to have a national effort to educate young people. And I know this is trite, but we've got to, at the end of the day, start where these problems begin, and that's young people making bad decisions.